Mother and Child Care, a leading center which provides advanced obstetric and gynecological care in Cuttack. He is past president of Foxy, speaker and participant in educational forums such as the E-Gurukul series addressing key topics like preterm labor and maternal health, contributor to public awareness and women's health education via platforms like the Times of India. Welcome, sir. He will be speaking on osteoporosis and fragility in elderly women, role of gynecologist in prevention.
For the last 45 years, the audience was gynecologist. Very few occasions I find a conglomeration of the various disciplines of medical fraternity. Here, physicians, surgeons, orthopedic surgeons, endocrinologists, and the different faculties of medicine. See, the physicians, surgeons, and gynecologists, the three primary faculties, disciplines, all have the same aim of alleviating disease and suffering of humanity. But the temperament is different. The surgeons, orthopedic surgeons, they feel that we have got two hands. We can win the hands, win the world by our two hands. The physicians say that we have two brains. With the two brains we can think, and by thinking we can win the world. But we gynecologists say that the whole universe rests with our two fingers. Very happy that this evening we are a conglomeration of various disciplines aiming at solving the problem of osteoporosis. And that's why the born the new society, Osteoporosis Society. But there is no dearth of society in India or in the world. In our own faculty we have got different subspecialty and different societies. But there is a need. This is something which is a collaboration of other disciplines for a common objective of a particular very prevalent entity, both man and women. And therefore, OSCE, the Osteoporosis Society of India, was born. I congratulate all the council members, the president and the secretary, and everybody for the purpose of bringing us together for that. And I'm really quote from Dr. Tanna that how powerful is C God and how powerful is F God. FG is Foxy combined with OSCE. Only then you can grow and all that. And therefore, I thought that all gynecologists present over here are fortunate here to be combined with this particular entity for that. Well, the collaboration is not new. We are the specialty, the gynecologists are the mothers. We are the mothers of almost many societies born in this country and globally also. Because we deal with, we are a special healthcare provider who deals with the creation to cremation. I think that's why we have got a collaboration earlier with the Aisha Park Society, with the Pediatrician Indian Society of Perinatology and Biology, with the fetal medicine, with the radiologist, with the MBBS with the radiologist, with the cosmetic gynecology, with the dermatology, urogynecologists with the neurosurgeons, and now we are fortunate that we are combining with the hard core, I think orthopedics and hard combining with the soft entity, and in between the interim part of the endocrinologist for that. I congratulate this effort for combining this for that. And ultimately, I wish that this society will grow for the purpose of well-being of the mother with the men and women combiningly, so that our achievement will be there. I think I will propose one thing, that the society is a combination of everything for them. Find out who are the wives are the gynecologists, husbands are the surgeons or orthopedic surgeons. I think find out them and become a member, so that I think this society will go a long way for that and way forward for it. I bring greetings from the place of Lord Jagannath. Well, I have been given a different topic. I have not speaking of osteoporosis, frailty of women. I have given a talk on frailty of women, and this is the life cycle of women from the infant to the toddler to the adolescent to the full-blown women and the perimenopausal age group, and ultimately from beauty to frailty. and my talk is on frailty and osteoporosis today. Thank you very much for inviting me for that. So frailty in elderly women and osteoporosis and what is the gynecologist viewpoint has been the talk given to me, and I will present within a couple of minutes for that. Well, the prevalence approximately 10% of the people aged more than 65 live in frailty. 25% to 50% more than 85 years of age. No more frailty is a literary term. It is also a technical term for that. Definitions of India what is called a frail women. Recent systematic review and meta-analysis across 62 countries worldwide found the prevalence of frailty higher among women, 15%, than men, 11%. But there is a sex frailty paradox, meaning thereby that the mortality rate is lower in women than in men. And the cause is obvious for that, starting from the genetic issues to the different hormonal imbalance for that. So frailty in elderly women is a state of increased vulnerability to adverse health outcomes, reduced muscle strength, fatigue, slow movement leading to falls and complications thereafter, associated with altered hormonal changes as gynecologists perceive with this condition, and reduced anabolic response to protein synthesis and chronic low. And these are symptoms that could indicate you have frailty, which include a spectrum of symptoms like fatigue, losing weight, balance and stability issues, leaking pee and poop, social isolation, depression, and so on and so forth. So the symptoms of frailty are frequently feeling fatigued or exhausted, muscle weakness and reduction in strength, moving slowly or having other trouble moving around due to decreased strength and flexibility, having trouble with balance and stability, leaking pee or poop, urinary or bowel incontinence, and after all, social isolation. But the content is mainly the www. The weakness, the wasting, and working slow for that. And these are some of the factors which govern around this particular entity. It's not age related. Certainly age related is frailty, but it starts not from all cases. So genetic factors, epigenetic mechanisms, environmental factors, cumulative molecular and cellular damage, giving rise to reduced physiological reserve in various systems of the body, and then physical activity, nutritional factors, adversely affect combination gives rise to what is the condition of frailty for that. And fails, falls, delirium, fluctuating disability, that needs an increased care needs, admission to hospital, admission to long-term care for that. Menopause. My gynecologist viewpoint, I will say that we have all dealing with osteoporosis have been discussed in many seminars and workshops in our forum. In the Indian Menopause Society, we have a couple of discussions with that. And rightly, what the president now tells that there should be a uniformity between the different faculties treating, and one voice will be there, not three voices for that. Menopause is not an end of life, but a change of life. We always say don't pause for menopause. It's a transition for second adulthood. And ovaries are a wonder organ. Ovaries, after long years of dedicated service, has not an ability to retire gracefully. Instead, this wonder organ affects irritation over various systems of the body and organs, manifesting all these symptoms, including the osteoporosis. But studies show that there are differences between Indian versus westernized women. In menopause, urogenital atrophy and vasomotor symptoms are predominant in Indian women, not osteoporosis. But osteoporosis and mental health problems are predominant in Western women for that. That's a great difference between the Western women and Indian women for that. So frailty and osteoporosis, but in Indian perspective, 80% of women, the peak incidence of osteoporosis in India occurs 10 to 12 years, 20 years earlier than in Western countries for that. And therefore, more attention has to be given on prevention rather than the treatment for that. The frailty and sex-specific pathological characteristics in older starts from the osteopenia, osteoporosis, sarcopenia, which is all known as osteosarcopenia for that, and therefore gives rise to a fracture, incidence of fracture and recurrent fractures for that. The missed diagnosis is there, starting frailty syndrome often goes undiagnosed. The study revealed a significant correlation between osteoporosis and frailty syndrome with predictive accuracy of exceeding 75%. And the area of disability and mortality revolves around many factors like increased healthcare costs, polypharmacy, fragility fractures, delirium, weight loss, falls, recurrent hospital admission, and malnutrition and institutionalization. So frailty and women hormones in both the frailty syndrome and osteoporosis. Hormones, testosterone, estrogen, growth hormone, IGF-1, vitamin D and cytokines fluctuate similarly. Sarcopenic obesity, the coexistence of excessive adiposity and low muscle mass function is one of the leading causes of frailty. And importantly, osteoprotein, a marker of robust osteoclast activity, was significantly enhanced in patients with both osteoporosis and frailty syndrome based on Fritz criteria. And there are a number of literatures available, starting from reproductive factors and the relationship with physical and comprehensive frailty in middle-aged and older women, and there is a large-scale population-based study. And there was a J-sept relationship between the age of menarche, reproductive period, and frailty. Age at menarche less than 30 years and more than 60 years, 16 years. Reproductive period less than 35 years or more than 40 years are all associated with increased odds of frailty. There was a negative linear relationship between menopausal age, surgical menopause is associated with 30% higher odds of physical frailty for that, and that is also a very significant factor. It is a surgical menopause. This again a literature journal of the American Genetic Society gives one of the hormones that diminishes during menopause is estrogen, which plays a crucial role in maintaining bone and muscle cell health. And meta-analysis conducted claimed that the risk of frailty syndrome in women is reduced by 2% each year that a woman experiences menopause later in life. And what are the interventions? The interventions should be by everybody for that. And therefore, that nutritional interventions. One of the important part is the nutritional interventions for prevention of this particular syndrome. Exercise intervention. Dr. Tana has already pointed out how balancing the exercise is important, and walking is the best form of exercise, not the aerobics for that at this particular age for that. Pharmacological intervention. Many controversies surround about this particular pharmacological intervention. There are the days when HRT was very popular, and we have seen the pre-WHI era and post-WHI era for that. HRT, ERT or progesterone aiding giving rise to increased bone strength for that we have seen for that. So pharmacological intervention we divide into hormonal component is one aspect, and the other controversial thing which has already been spoken about, and all these things have given importance to the terapeptide or the decazole and all this second generation of this generation and discarding the biphosphonates. There was a time when biphosphonate was the first promoted by that in gynecology for that. I remember how science changes and all that. I remember in 1937, J.J. Thomson got Nobel Prize by showing that electrons are waves. And his worthy son after 30 years, J.J. Thomson again got a Nobel Prize by proving that electrons are particles, not the waves. But which is correct? Whether the particles are correct or the waves are correct. But the only correct thing is that both the father and son are the Nobel laureates. So this is the thing which based on science for that. And science also, we should compromise that. I always believe that we believe in the literature. We believe that the publications for that also. My personal view is that those who publish do not work, those who work do not publish. There is a global scenario for that. Those who work do not have time to think, and those who publish now with the internet and the laptop, with 15 minutes you can publish 50 articles that you should publish, and that's why we find good authentic evidence for that also. So this is all about pharmacological intervention for that. That's why there is a change in the protocol, and we have to go through the changes also for that. And pharmacological, then psychological intervention. This is also important in the coming generation. The socio-demographic changes, the psychological impact of the elderly women or man is most important for that also. Now, we have seen a drastic change in country. I have already said emptiness syndrome. The children are done and these are all empty. And most often they are lonely husband or lonely wife. The problem is magnified for them. We should think not only of the therapy of pharmacological intervention, but the social interpretation has to be done for that. We have seen now a new syndrome, Pika syndrome. I always say parents in India, children abroad. And this has been common in India and various look and corner of these individuals. So psychological intervention is a very important part. Social intervention is also a very important part, which I will highlight this in the changing demographic pattern for that. So women affected by osteoporosis factors due to rapid bone loss in perimenopause. The amount of bone loss, bone mass risk at the time of menopause is key to subsequent risk of fracture, and preventive is most important. I won't highlight about the BMD and other scoring system for that, but the screening is important. The International Conference of Frailty and Sarcopenia Research recommended frailty screening for all adults 65 years and more. And bone mineral densitometry is recommended as a screening for women 65 or elder, which every keynote address have already highlighted that. And there is stratification and screening tool like DEXA scan and other parameters has to be found out for that. So more and more is a preventive strategy. Perimenopausal and postmenopausal women experience a rapid decrease in muscle mass and strength and thus are more vulnerable to age-related frailty. I think more importance has to be given for HRT for that. I agree with that also. Apart from it, the nutritional vitamin D has been shown to effectively improve hip bone mineral density in postmenopausal women and reduce the incidence of falls. Intrinsically linked to the vitamin D and phosphorus calcium metabolism is magnesium, which Dr. Tana has already pointed out this particular aspect. So, by calcium in a proper dose, magnesium, vitamin D are the main theme of preventive measures for that. And therefore, another supplementation that may decrease progression and treat osteoporosis, vitamin K2 has been added to it also. So, the nutritional recommendations for prevention of frailty have been number of cases: the diet, Mediterranean diet, reduced sodium diet. Reduced sodium diet is also important for that. High calcium diet and calcium supplementation. Now the era of preventive thing, no treatment for that. Adequate intake of vitamins and minerals, high fiber diet, adequate protein intake when combined with exercise, and higher magnesium intake. There is a lot of literature now coming out in favor of magnesium. It is associated with a low risk of frailty in older infants. It is not only the calcium and vitamin D, the addition of magnesium is most important. And again, the prevention is most important for that. So total magnesium intake and risk of frailty, there are a number of articles here that vitamin D supplementation, risk of fractures, a number of meta-analytic studies for that, and resistance training is important, which Dr. Tana has already pointed out for that. Prevention of osteoporosis includes appropriate nutrition and exercise and the removal of risk factors for that. But we preach, we don't practice that. That's the main problem with that. And the treatment can be considered if the woman has a previous fragility fracture, a DEXA BMD T-score less than 2.5 or a T-score between -1 and -2.5 with higher fracture risk. So to summarize, ladies and gentlemen, managing conditions associated with frailty is important. In addition to frailty, there could be some metabolic disorders like hypertension, diabetes, mellitus, cardiac disease for that. Physical therapy is one of the very important things. Specific rehab program has to be done. It should be a specific rehab program, nutritional support, physical activity program, community support, and long-term care are the key for dealing with the frailty and osteoporosis. Ladies and gentlemen, we don't have control over the length of life. Nobody has a control over the length of life, but certainly have a control over the breadth and width of life, and this has to be maintained for that. And don't take a credit that we have improved life expectancy for that. Medical faculty is contributing for the improvement of the life expectancy. But the need of the hour is health expectancy. Till the last breath of life, I think how physically, mentally, it should be absolutely normal. That should be our approach for that, and that's my request for that. Thank you very much, ladies and gentlemen.